Drug and alcohol counselors play an integral role in the lives of individuals that do seek treatment. However, there's a question of whether or not there are enough counselors to fulfill the needs of various communities. Keep watching to learn more about the need for drug and alcohol professionals. The shortage. Leading professionals in the field of addiction believe that the country is facing a shortage of drug and alcohol counselors. The passage of the Affordable Care Act, ACA, and Medicaid expansion led to greater access to treatments in many states. This in turn led to an increase in the number of counselors needed to provide treatment. Additionally, the ACA and Medicaid expansion increased the need for pharmacists and other professionals to help treat drug and alcohol addiction. Despite the increase in the number of counselors needed, there have not been enough people trained to fill these roles. The pandemic. During the pandemic, there has been an increase in substance abuse. According to APA.org, around 13% of Americans have reported starting to use or increase their substance use to deal with stress and emotions surrounding the pandemic. To address the increase in substance abuse and decline in mental health, more counselors were needed to treat substance use disorder and mental health issues. Budget cuts. Budget cuts have reduced the number of counselors that can be trained. These budget cuts are left over from the pandemic, making the effect of the pandemic still felt to date. Concerns over the budget have led to fewer people entering the counseling field. The opioid crisis. The recent opioid crisis has created an even greater need for these counselors. Prescription painkillers and heroin are the two most commonly abused illicit drugs in the U.S. The increase in the use of heroin led to the creation of drug courts in many jurisdictions. These courts help provide treatment for individuals that get convicted of drug-related crimes. The need for drug and alcohol counselors will only increase as drug use continues to rise in the U.S. The cost of treatment. The cost of treatment has affected the number of counselors because of the need to provide less expensive treatment than inpatient and residential treatment. The need for counselors has increased, but there has not been much change in the number of qualified counselors. This shortage is a significant issue, especially in rural areas where fewer professionals such as counselors are available. Addressing shortage. According to the U.S. Bureau of Labor Statistics, the number of drug and alcohol counselors is expected to rise over the next decade by 23%. This growth rate is much faster than average. This may be based on the need for more counselors to help the increasing number of opioid addicts. The increased demand for counselors may be due to the rise in heroin use and the need for more counselors to provide treatment. Counselors may obtain a degree from a college or university, but may need a master's degree to obtain licensure. However, you may be able to work as an addiction professional without a master's degree. An alternative in California is to take a certificate program that prepares you to be able to apply for a CATC-1 certification. Intercoast Counseling Program. If you want a certificate or degree in drug and alcohol counseling, you can apply here at Intercoast. Our hybrid or fully online program offers you the training you need to work in this field. You can earn your degree and certificate while working on your career. Request information today and start your career path. And if you enjoyed this video, be sure to like, comment, and subscribe.